Welcome to my channel, Royal Lokesh channel. In today lecture, I will be dealing about gangrene. First, we will talk about the gangrene definition. Gangrene is a dangerous and potential fatal condition that happens when blood flow to a large area of tissues cut off. This causes the tissue to break down and die. Gangrene often turns the affected skin to greenish black color. You can see the image. They're like it's become greenish black color. That is becoming gangrene. However, the word gangrene is not related to the color green, but the condition itself it comes from Greek and Latin words for gnawing a sore or decayed tissue. I mean saying about that it's not a color matter. I'm saying it's injury happening there. That is called gangrene. Next, let us deal about types of gangrene. There are digangrene, wet gangrene. Digangrene occurs when blood supply of tissues cut off. The area becomes dry, shrinks, and turn black. It mostly happens in diabetes people. Wet gangrene occurs if bacteria invade this tissue. This makes the area swell, drain fluid, and smell bad. Next, let us talk about wet gangrene and dry gangrene differences. Like wet gangrene is mostly occurs in the bowel, dry gangrene limbs. Okay. Next, wet gangrene venous obstruction, dry gangrene arterial obstruction. Wet gangrene moist, swollen, dark. Dry gangrene dry, shrunken, black. Wet gangrene no clear line of demarcation. Dry gangrene presence of line of demarcation. Wet gangrene there is bacteria present. In dry gangrene no bacteria present. And wet gangrene prognosis is poor, but dry gangrene prognosis is better. Who is at risk for gangrene? People with diabetes. As I said before, also diabetes is a condition very dangerous. Like most of the people, when they'll get injury, they most of the times like they'll get gangrene. So they are better don't get an injury of any part of the body. And peripheral artery disease, Raynaud's disease higher at risk for gangrene, skin infections, injuries, burns, dog bites, and frostbite also put people for risk for gangrene. It's the most worst condition of gangrene. Symptoms. Symptoms of gangrene depend on location and cause. Dry gangrene usually starts with a red line around the affected area. The area turns dark and black. This is a symptom of the gangrene, coldness and numbness in the affected area, pain in the beyond the affected area. Like where injured also pain will come, but above that also will get pain. And redness and swelling around a wound, sores that keep cropping up in the same place, persistent unexplained fever with temperature higher than 100.4 degrees Fahrenheit or 38 degrees Celsius, a bad smelling wound, and striking discoloration of skin. Skin changes to color like green, blue, red, bronze, and pus or discharge from wound, and crackling feeling on the skin, confusion, fever, especially the gangrene is internal, shock. Now treatment. Most of the times we use antibiotics for everything. So it's better to remember antibiotics all. In pharmacology, most consonant antibiotics. Like most of the time you should say antibiotics only for everything. This medicine can be used to kill bacteria in the affected area. They are used only when gangrene is present. Remember, only when gangrene is present, we should use antibiotics or else no. Surgery to remove the dead tissue and maggot debridement. This is non-surgical alternative to traditional debridement. During this procedure, clean fly larvae are placed in the affected area to eat away dead tissue and remove bacteria. This is painless procedure. Like maggot debridement is like rare condition, you will use this. Most of the times you will use first and second, like antibiotics and surgery to remove dead tissue. Maggot debridement is like very traditional condition. It will do in traditional areas like tribal people and all. Forest people will do this. Thank you. For more videos, subscribe my channel. Click on the bell icon for more updates.